Hello everyone, today I will be presenting information on the field of medicine surgery. Surgeons have often been highlighted in several TV shows and are infamous for being a demanding field. This video will cover the average salary, the competitiveness, path, and whether or not this occupation would suit you, along with additional resources. However, this video will be unable to cover all aspects of this diverse field. So if you're interested, I highly suggest that you delve into more research on this fascinating field. This video has the sole purpose to introduce you to the broad field of surgery. Although another video will cover this more in depth, it is important to look at the costly and extensive amount of education that is needed to become a surgeon. There are several paths to earning your MD, for example, going directly into a BSMD program. However, this video will only cover the most typical path. Firstly, you'll need 4 years of undergraduate schooling, preferably in majors related to medicine, such as pre-med or biochemistry. Then in preparation for applying to medical school, you will have to take the MCAT, Medical College Admissions Test, which will be covered in more detail in a separate video. Receiving admission into medical school is quite difficult, as it is highly competitive. Then through medical school, you will have to take several more clinical tests, like the first 2 parts of the USMLE 3-part examination. USMLE Step 1 covers basic medical principles and is required before entering the 3rd year of medical school. The USMLE Step 1 is a multiple choice exam. Then during your 4th year, medical students are required to pass the 2nd part of this exam. This part covers diagnosis and disease development and is 2 separate tests. The clinical knowledge test is a multiple choice test, while the clinical skills portion is hands-on. Near the end of medical school, students narrow down their medical specialty options and are matched with a residency program. Finally, you will become an intern, also known as a first-year resident, where you are typically assigned menial work and are on call for long stretches at a time. You do begin to receive payment. The typical salary for a first-year resident is $59,300. Then you have to pass your USMLE Step 3, which will cover clinical management and is used to assess your ability to practice medicine safely. This is typically completed after the 1st year and is required before entering the 3rd year of residency. Depending on the type of surgery you wish to specialize in, you will have a different amount of years of residency. Residencies usually take about 3 to 7 years with extremely long hours. Through the residency, your salary will typically increase by $3,000 to $5,000 with each additional year of training. You should also become board certified. Each test depends on your specialty, and that link has more additional information. As mentioned, surgery is an extremely diverse field. Here are the 14 surgical specialties that are recognized by the American College of Surgeons. General surgery, as the title suggests, covers a broad spectrum of surgical conditions. They typically have a 5-year-long residency and acquire knowledge in managing conditions related to gastrointestinal, vascular, endocrine systems, and much more. Thoracic surgery involves the care of patients with pathological conditions in the chest. These would be things such as cancers of the lung, esophagus, and chest wall, or coronary heart disease. Colon and rectal surgery consists of skills and knowledge to diagnose and treat various diseases of the intestinal tract, colon, rectum, anal canal, and perianal area. Colon and rectal surgeons care for patients with diseases that affect the lower gastrointestinal tract. Obstetrics and gynecology teaches the physician to provide medical and surgical care for the pregnant patient. This involves delivering the baby and treating conditions that involve the female reproductive system. Ophthalmic surgery is the care of visual problems. They treat medical disorders of the eye through surgical procedures. Oro and maxillofacial surgery teaches diseases, injuries, and defects involving the head, neck, face, jaws, and hard and soft tissues of the oral and maxillofacial region. Otolaryngology involves providing medical and surgical care for ailments in the ears, respiratory, and upper alimentary systems, and related structures. Pediatric surgery entails the diagnosis and care of surgical problems in children. They can operate on children from the newborn stage through the teenage years. There are also multiple subspecialties within pediatric surgery, such as pediatric oncology. Urology manages medical and surgical disorders of the adrenal gland and the genitourinary system. Vascular surgery provides care for diseases that affect the arteries and veins through the body. This would include things such as the hardening of arteries or aneurysms. Neurological surgery is the discipline of medicine that involves the treatment of disorders of the central, peripheral, and autonomic nervous systems. This will also include supporting structures such as the vascular supply. Plastic and maxillofacial surgery is the repair, replacement, and reconstruction of the body for both defects of the body and the underlying musculoskeletal systems, as well as cosmetic procedures. Orthopedic surgery is a broad field as it covers the care of the musculoskeletal system. This entails many different subspecialties within orthopedic surgery, such as trauma surgery or joint replacement. Orthopedists may have an additional 1 to 2 year fellowship to achieve added qualifications. Gynecology oncology focuses on the comprehensive management of patients with cancer of the female reproductive system, known as gynecologic cancer. On a day-to-day basis, a surgeon will mainly spend time preparing for and performing surgeries, along with providing counseling on different cases. Some other professionals you will be working with include anesthesiologists, nurses, technicians, and many more. Overall, becoming a surgeon is a major commitment, with them working 50 to 60 hours per week at possibly strange times. The average salary of a surgeon is around $402,301, but varies depending on the different specialties and areas. Being a surgeon is also a stressful and rigorous profession. A person who wants to become a surgeon needs to have endurance for both the intensive training time and long hours. It also requires both physical and mental strength. You also will need good communication and people skills to effectively communicate with other people you will be working with and to communicate with your patients. A good surgeon will also need to be a good leader to effectively assess their team's strengths and weaknesses to provide the best patient care. Becoming a surgeon is not for everyone, and that is okay. There are plenty of other excellent occupations to pursue within the medical field. The path to become a surgeon is extremely competitive and requires constant training, along with an extensive high-level education. It is a huge commitment, and I wish you luck if you choose to pursue this career. Please keep in mind that this career is not for everyone. If you are interested in learning more about becoming a surgeon, there are plenty of online resources. I suggest you look into different medical schools or hospitals, which typically provide a wide variety of information. Thank you for listening.